I work predominantly with people with mental health problems who have associated communication and or swallowing difficulties. And these would be people, adults, 18 upwards. Probably the largest proportion of my caseload are older people who have with dementia. Speech and language therapists have a particular role in assessing somebody who presents with a communication difficulty when they have dementia. We are able to help with differential diagnosis, which is very important. People with dementia obviously have a gradual loss of ability, also in the area of their communicative ability. And this can be very distressing, both for the person themselves and also for their carers and family. But very often there are areas of retained or residual ability, and it's these sort of areas that we are wanting to identify, and perhaps then we can work with the person or with their carers to build on those areas to maximise the potential for them. When people have dementia and they are losing their ability to communicate effectively, often this leads to a loss of confidence for the person as well. Very often their friends drop away if they can't have the sort of conversations with them that they used to have, or if the person themselves isn't able to be involved in the activities that they were involved in previously. So it is very distressing for the person. Often communication difficulties can result in the person becoming frustrated. They may appear then to be aggressive, but very often this is because they can't convey their thoughts or their feelings or their what they want to say effectively. This obviously puts a huge strain too on carers and other family members. People with dementia can often feel marginalised, or at least their carers can feel marginalised, or family members. And I think that this can result in a lot of misunderstanding about the condition. And I think certainly speech and language therapists have a role here certainly in our support for the person with dementia, but also in educating others about the communication difficulties people can have and how they can be overcome. As well as seeing people with dementia who have communication difficulties, as speech and language therapists, we also work with people who have swallowing difficulties, dysphagia, and this does form quite a large proportion of our role, and particularly as the dementia progresses, people are then much more likely to develop swallowing difficulties and need advice and support. A significant part of the speech and language therapist's role with people with dementia is to offer support to them and to their family or carers, and enable them to find alternative ways of communicating where they can, or where that's not possible, to introduce strategies that can be used by the family or the person themselves to ease communication.
I didn't know much about Alzheimer's like most people unless they get involved with the thing. But it came so slow that I first didn't notice, because as you get older, your memories fade. It seemed to be a natural thing. Some people worse, some people better. Her condition is really deteriorated so much. It was gradual. She lost the right words, like I actually do, you know. English is my second language. She starts a sentence and never finishes it, and then gets frustrated and actually more confused than she was at the beginning. And that is the worst aspect of our life, amongst other things. You don't want to really lean on anybody, so sometimes we struggle. It is the practical, sometimes very important things. I can see her facial expression. She's in a panic situation, and I ask her, do you want to go to the toilet? She can say yes. And she arrives quite a few times late, and I get, but why didn't you tell me before? But I can see that she's not readily say what she thinks. She struggles to come out, even that yes is hesitant. And our days going in a vacuum kind of thing without speech. I before never realized how much it means to say things. Her confused state is really a thing which is a barrier. She knows what's happening. I'm sure she understands what we're talking now. But I don't know, I would like her to connect into conversation, but one or two words like no or yes, or, basic. She's unable to carry on things in communicating, letting me know what she wants, what she really needs. It's making our situation, my job, and her condition really bad. In a Hungarian club, we were really very much involved, and she was more active than me. Since she stopped that dinner club, we lost quite a lot of friends because that was the hub of being amongst with people, sort of territory and place. We have very precious few friends left. Our children are far away. Judy's visits, which now really the only positive thing, as I told you before, brightens up the day by her personal attitude towards Rachel. She's got the skill to pull a few more sensible sentences out, and her know-how, when they sit down, they're talking. It's a good combination of personality of Judy's and her skill, professional skill. She can make Rachel feel whole. It sounds funny, because when you lose one of your faculties, you cannot see. Somebody gives you a pair of glasses, you are whole again, and she can give the ability of communicate. We are together, we love each other. We have married for 50 years, but this sort of confinement is a double solitary confinement, her and me in the same sort of vacuum, and hardly anybody can come into that cell. But Judy has a key for it, can't let us out, but she can come in. Do you understand? It's like somebody comes into a dark room and you can see better in it,